Welcome to today's video. I'm going to do a highlight of the FAQ from the Alabama Board of Pharmacy website, ALBOP. So these are all questions that I think are definitely need to know, and you'll probably see in some form on your MPJE for Alabama. So, are there continuing education requirements for a pharmacy technician? In addition to any other registration requirements, a pharmacist technician shall complete 3 hours of continuing education annually, with 1 hour being live. And they renew every 2 years, so in 2 years in full they have 6 hours to live. But their hours do not roll over. So can a technician carry over continuing education hours from 1 year to the next year? No. They must obtain 3 hours of continuing education each year, with 1 being a live credit hour. Continuing education hours must be earned each calendar year. So next question of importance. If a pharmacist completes more than 15 ACPE approved CE hours in 1 year, can extra hours be carried over to the next year of use? Yes. So up to 12 extra continuing education hours can be carried over to the next year, but once carried over, they cannot count towards live hours, regardless of whether or not they were completed live at the time. So in a sense, if you do a lot of credit hours in 1 year, and you get your certain amount of live for that year, which is 3, pharmacists need 3 live hours each year, you can go a whole year and only get 3 live and renew your license at the end with only 3 continuing education hours because you got so many the year before. So I doubt that's a question, but if they ask what's the minimum that could potentially be taken in 1 year for pharmacists to renew their license, it's 3. Yeah, and it says carry over to the next year. So, next question. Under what circumstances can physicians treat themselves or members of their immediate family? So physicians generally should not treat themselves or members of their immediate family except in emergency situations or isolated settings where there is no other qualified physician available, and only until another physician becomes available. Prescribing or dispensing a controlled substance to oneself or to one's spouse, child, or parent is not allowed unless such prescribing or dispensing is necessitated by emergency or other exceptional circumstances. So I read that as even in an isolated setting, a physician can't write controlled substance to oneself or one's spouse, child, or parent. So the next question of importance, pretty much all of your weight loss medication questions for Alabama. So, may a physician prescribe a Schedule II controlled substance for patients for the purpose of weight reduction? No. May a physician or agent of a physician call in orders for controlled substance for patients for purpose of weight reduction? No. May anyone other than a licensed MD or DO prescribe controlled substances for weight reduction? So that answer is only a doctor of medicine or doctor of osteopathy licensed by the Medical License Commission of Alabama may order, prescribe, dispense, supply, administer, or otherwise distribute a controlled substance in Schedule 3, 4, or 5 to a person for the purpose of weight control, weight loss, weight reduction, or treatment of obesity. An exception is that physician assistants, nursing practitioners, midwives can prescribe Belviq, BELVIQ, or QSMA, QSYMIA, for such purpose. If a physician assistant, nurse practitioner, or midwife prescribe one of those 2 prescription, the prescriber shall comply with the guidelines and standards of this chapter, which apply to the MDs and the DOs. So, may a prescription or order for any controlled substance for a patient for the purpose of weight loss or treatment of obesity be called into the pharmacy? No. Such prescriptions may not be called into the pharmacy by the physician or agent of the physician. Such prescriptions may be written or e-prescribed. What is the maximum days supply a physician can prescribe for weight loss medications? 35 days. Then they have to set up an appointment, and as long as their medically established goals have been met, the patient can have another prescription for a 35 days supply. That doesn't really count for the 2 brand names I mentioned, QSMA and Belviq. So under what circumstances may a prescription for weight loss medication be refilled? So after an original prescription for either of those 2, and an office visit for evaluation, the prescription may be refilled up to 5 times in a 6-month period, which go ahead and implies that those are scheduled drugs or controlled drugs in either 3 or 4. Refills are specific to the brand name drugs and refills are not allowed for generic substitution or for individual prescriptions of phentermine or topiramate. So you can't do that with the generics of those two drugs. All right, our next question that seemed important. What is the technician to pharmacist ratio in Alabama? That's 3-to-1, with 1 being certified. What is the minimum number of hours a pharmacy must be open? That's a minimum of 20 hours per week unless they apply to the board for a waiver or exception. So, what about operating a pharmacy during pharmacist breaks? The temporary absence authorized with the rule for the pharmacy break shall be limited to 30 minutes, and the pharmacist must remain in the facility. So what steps should a pharmacist take in the event of a pharmacy burglary, robbery, or theft? So notify the appropriate local law enforcement agencies. File Form 106 with the DEA if controlled substances are involved, located on the DEA website. Notify the Alabama State Board of Pharmacy. Send a copy of DEA Form 106 and a copy of the police report to the Alabama State Board of Pharmacy by email or fax. If a theft is committed by an Alabama Board of Pharmacy licensed pharmacy staff member, report the name and permit or registration number of the member of the state drug to the state drug inspector assigned to your area. If a theft of a non-controlled substance occurs, notify the area Albop State Drug Inspector. So if it's a non-controlled substance, you do notify your area Albop State Drug Inspector. And then also if the theft is committed by an Albop licensed pharmacy staff member, you report the name and permit or registration number of the member to the state drug inspector assigned to your area. Other than that, the Alabama Board of Pharmacy, you send them DA Form 106 and a copy of the police report, and you tell the police first, of course. Alright, next question on emergency refills. So, can a pharmacist give an emergency refill on a weekend if the patient needs it when there is no refills left in the prescription? So as long as the prescription is not a medicinal agent listed in Schedule 2, and the dispensing pharmacist notifies the prescriber of the emergency dispensing within 72 hours of such dispensing. So obviously that's situational, but you have 72 hours to notify the prescriber that you did this in the emergency situation. So may syringes be sold in Alabama without a prescription? That answer is yes. Next question. What changes may be made to a C2 prescription? So, according to the state, a pharmacist may add or change the patient's address upon verification with the patient. A pharmacist may add or change the dosage form, drug strength, drug quantity, or directions for use, or issue date only after, or directions for use or the issue date only after consultation with and agreement of the prescribing practitioner. Any consultation and changes should be documented by the pharmacist on the prescription. So what changes can be made to a C3 to C5 prescription? So 3, 4, and 5, according to the state, a pharmacist may add, change dosage form, strength, quantity, directions for use, issue date, or patient address only after speaking with the prescriber and documenting the prescription. So this one mentions that for the state to change a C3, 4, or 5 patient address, you have to speak with the physician. Whereas a C2 prescription, a pharmacist may add or change the patient's address upon verification of it. So again, with 3, 4, and 5, if the prescription is missing the prescriber's signature, pharmacist must then forfeit the written prescription and take a new one verbally and reduce to writing. Can you do a partial fill on a C2 prescription? So there are two rules here, because one was established in 2016 under the CARA, the Comprehensive Addiction and Recovery Act. So what it used to be, and kind of still is that yes, you can partial fill a C2, but it must be documented on the prescription and the remaining balance must be filled within 72 hours of the partial filling. If it is not filled within the 72 hours, the remaining balance is forfeited and a new prescription is required. There's an exception for long-term care facilities and patients with diagnosis of terminal illnesses. And I assume that means you can partial fill it and you have longer to fill. It's a little unclear, but Another question is, what is the new law regarding partial filling of Schedule 2? So in 2016, CARA passed. CARA allows pharmacists to partially fill Schedule 2 controlled substances. A prescription may be partially filled if it is written and filled according to the state and federal laws. So, any prescription you get for C2. The partial fill is requested by the patient or the prescribing practitioner, and the total quantity dispensed does not exceed the quantity prescribed. Remaining portion of the partially filled prescription must be filled within 30 days of the original written prescription date. There is no single specified way to fill or bill prescriptions under the CARA update. So yeah, the new law in Alabama pretty much says you have 30 days to, if you partially fill a C2, which C2s don't have refills, so if you partially fill one, they have 30 days to pick up the rest of it. Should an Alabama pharmacist honor a C2 prescription from an out-of-state nurse practitioner? Yes, because registered nurse practitioners have prescriptive authority to prescribe a C2 in the state of Alabama. And of course, they would need to have any of their DEA registration as well. So, next question for Schedule 3 and 4 prescriptions. May be telephoned in or faxed to the pharmacist, or the practitioner could go to the pharmacy counter and request that the drug be dispensed to a patient. Just FYI. Something about sterile compounding for outsourcing facilities, that's 503B. Some more questions here. How often must one successfully complete written and media field testing when preparing low or medium risk compounded sterile products, CSPs? That's annually for low and medium risk. For high risk, that's semi-annually. So which type of CSP's risk level can be prepared for immediate use? Only low risk CSPs may be compounded for immediate use. How soon must an immediate use low risk CSP be used? So if you make any kind of immediate use, it should be low risk, and you can use this. So the immediate use low risk compound must be administered within 1 hour or less from the start of the prescription, or start of the preparation. Otherwise, the preparation must be discarded. What is the maximum beyond use date for a single-use container, which is the bags, the bottles, the vials? The maximum BUD is 6 hours after entry into the vial. If the vial is entered in at least a iOS Class 5 environment, if it's entered in less than an iOS Class 5 environment, the maximum, which is 6, 7, it's higher. The maximum beyond use date is 1 hour. So 6 hours if it's iOS 5 or 4321. But if it's above iOS 5, 6, or normal Air 7, the maximum beyond use date is 1 hour for a single-use container. What type of sink is required in the anteroom? There may be a hands-free sink located in the anteroom with either a sensor foot pedal or something that nature. What type of environment must I weigh or mix non-sterile products in? That's an iOS 8 environment or better, like a 7. How many air exchanges are required in both the buffer and anterooms per hour? That's 30. Can a pass-through be used between the buffer room and the general pharmacy? So if the general pharmacy has a buffer, or has a pass, if the buffer room has a pass-through, it should be used during the time of evaluation to determine the impact of ISO 7 air. Just something to note there, really. Where must a pressure meter be placed when conducting sterile compounding? A pressure meter is needed where the anteroom connects to general pharmacy, and if there is a wall between the buffer and anteroom, a pressure sensor is needed there too. If there is no wall between the ante and buffer rooms, then there needs to be a velocity meter at the division line between the buffer and anteroom. So a pressure room is needed where the anteroom connects to the general pharmacy, and if there is a wall between the buffer and anteroom, a pressure sensor is needed there too. Velocity meter if there is no wall in between the ante and buffer room. And of note, for those two weight loss drugs, Cusima and Belvic, those are Schedule 4. I was vague a second ago. So I think these are highlights from the Alabama FAQ. If you're taking the MPJE for Alabama, I would definitely listen to this or go over those specific questions pretty much daily until you are ready to take the test. Alright, good luck.